Community Health Worker Training, Cardiovascular Health and Diabetes, Module 10C, Mental Health and Wellness. Learning outcomes for this mini-module. Upon completion of the mini-module, participants will be able to discuss how depression can be managed, discuss the relationship between stress and depression and its effects on the heart and one's health, and identify community health worker activities that can help community members cope with stress and depression to improve their well-being. Treatment for depression. The two most common types of treatment for depression are medication and talk therapy, which is also called psychotherapy. So we'll start with medication. There are many different antidepressant medications, and it may take some trial and error to find the right one for each individual. They also take 4 to 6 weeks to fully work, so it's important that clients know they have to be patient and not give up on the medicine if it doesn't work right away. Medicines sometimes have unwanted side effects, which may be temporary. So people may feel jittery or sleepy when they first start taking medication. They may occasionally have worsening depression, suicidal thinking or behavior, or not wanting to interact with people. And it's important that they talk to the doctor if they're having any of these side effects or any other side effects. And also remember, that if one medicine doesn't work, the doctor can switch medicines or can try a different dose. It's also really important for them not to stop taking an antidepressant medicine without talking to the doctor about how to stop it safely. In terms of talk therapy, there are also many different approaches to psychotherapy. It may be one-on-one, it may be family therapy, or group therapy. For severe depression, hospitalization may be needed, especially if the person is suicidal. Depression can make a person feel very tired, worthless, helpless, and hopeless. Such negative thoughts and feelings make some people feel like giving up. It's important to know that these negative views are part of depression. In the meantime, there are things you can encourage a person with depression to do, including set realistic goals, breaking large tasks down into small ones, and doing what's most important first, and also just doing the best they can. Taking part in activities that may make them feel better, even if they don't have a lot of energy or they don't feel like going. Sometimes if they can force themselves to go, it actually helps them to feel better temporarily. Being physically active, going to a movie, a ball game, or taking part in religious, social, or other activities sometimes helps. The person should expect the mood to improve slowly, not immediately. Feeling better takes time. And people rarely snap out of depression, but they can feel a little better day by day. The other important thing is to let people help. Let family and friends help, as well as seeing a professional. For depression that does not respond to medication or psychotherapy, electroconvulsive therapy, or ECT, may be recommended. ECT is done under general anesthesia, which means the person is put to sleep, and a small electric current is passed through the brain, which intentionally triggers a brief seizure. ECT seems to cause changes in the brain chemistry that can reverse symptoms of depression. A newer treatment is transcranial magnetic stimulation, or TMS. TMS painlessly delivers a magnetic pulse to stimulate nerve centers in the region of the brain involved in mood control and depression. And as with psychotherapy or medications, some of these treatments work well for some people and some work well for other people. So it's really important for someone who's depressed to stick with it and not give up. So to stick with the treatment, to stick with the doctor or the mental health professional who's treating them until they find a therapy that works for them. We also know that exercise helps depression. In fact, in some studies, it has been found to help as much as antidepressant medication. So that's a lot. And of course, it's hard to do exercise when you're depressed and you barely have the energy to get out of bed. That's one of the things that makes that a difficult treatment for people. But even if you can get them to start walking, even that amount of exercise can help. Phototherapy or blue light therapy is an effective treatment for a type of depression called seasonal affective disorder, or SAD. And that's a type of depression that comes on people during the winter when they have less exposure to sunlight. And that therapy is simply sitting in front of this kind of special light for a certain number of hours every day. So one thing that's important to know about therapy for depression is that people don't have to choose one or the other. So for instance, we know that taking antidepressant medication and going to psychotherapy together works better than either one alone. And certainly adding exercise to both of those things makes it even more likely that the treatment is going to work. There are 4 steps to understand and get help for depression. The first thing is to look for the signs of depression. It's pretty straightforward. And then the second step that's really helpful is to understand that depression is a real illness. It's a medical illness, just like diabetes or like hypothyroidism. It's a real illness. And depression can be stigmatized like other mental illnesses. And so sometimes people feel like it's a failure. It's a failure of will. They just can't get themselves to do whatever it is that they're having trouble accomplishing, or they just need to snap out of it. And it's really important to talk about depression as an illness, as opposed to anything having to do with the person's own will. Okay, because that helps them get over the stigma of having it. It also makes them more likely to be willing to go for treatment. So going to the doctor and or seeing a mental health professional is a really important step. And in terms of you as a community health worker, the most important thing you can do for the depressed person is to try to help get them into treatment. So try to help them connect with their doctor or their therapist if they have one. And sometimes starting with the family doctor is the best place to start. Actually, a lot of people who are depressed get treatment just from their regular doctor. But in addition, other resources that you can connect the person with are community mental health centers, family services, social agencies, or in some cases, even clergy members. Once they get into treatment, it's really important as a community health worker for you to encourage them to stay with the treatment until they feel better, and to remind them that it may take several weeks or even months sometimes for the treatment to fully work. And you want to encourage them to let their doctor or their therapist know what's working for them and what isn't working for them. As I mentioned before, sometimes you might need to help them actually make an appointment or go with them to the first appointment, just to really help make those connections, because when you're depressed, you don't have the energy to do anything sometimes. And even just picking up the phone can be an insurmountable barrier to getting treatment. You may also need to check on whether they're taking their medication regularly. So remember that we said that depression interferes with memory, right, and concentration. So you want to check in with them. Continue to offer them emotional support and encourage them to follow the doctor's advice about the use of alcohol while on medicine, and encourage them not to use alcohol or drugs or smoking to cope with the depression, because those then, in some cases, they make the depression worse. In other cases, they add an additional problem onto the depression. Also be sure to be understanding, patient, and offer encouragement. It can be sometimes frustrating to work with a depressed person because it seems like they never want to do anything to help themselves feel better. That's part of the illness. That's part of the depression. So try to be patient with them. Really important not to ignore any remarks about suicide or about the fact that they may be thinking of hurting themselves. If they say anything like that, it's really important for you to either have them call their doctor or their therapist while you are there watching them do it to make sure they actually do it, or to do it yourself if they're unable to do it, because you can intervene to prevent somebody from committing suicide. Let's review what stress and depression have to do with heart disease and stroke. People with depression or chronic stress have a greater risk of heart disease. So they have a greater risk of developing heart disease, including heart attack and stroke, later in their lives. And the opposite is also true. A heart attack or a stroke can cause depression. In addition, people with heart disease and depression have greater risk of dying if they do have a heart attack or a stroke. So they're less likely to survive it, and they're less likely to heal from it afterwards. Let's talk a little bit more about the role of community health workers in working with people who have stress or depression. So one thing you can do around education and awareness is teach wellness strategies. So the more generally healthy, both mentally and physically, a person is, the more they can roll with the punches, essentially, the more resilience they have when they're exposed to stress. Education and awareness programs also should teach about stress and healthy ways to reduce stress. It should teach about depression, about the signs and symptoms of depression, and the need to get help. And it should also help destigmatize depression by talking about it as a medical problem, just like any other medical problem. Community health workers can also offer care and support to people who are depressed by recognizing the signs of depression in clients and connecting them with care, and then supporting them once they get into care to help them persist with treatment and to help them make healthy lifestyle decisions, while they're being treated. So encourage them and support them to continue to exercise, to eat well, to try to get enough sleep, and not to isolate themselves, but to, reach out to family and friends for support. So in this final video about community health workers, they really talk about community health workers' role in promoting wellness generally. And you'll see this community health worker working with a particular client who has some medical problems and is depressed. But really what I love about this video is the big picture of what community health workers can do, and really how they work with their clients to support them in a unique role that's different from the role of the doctor, the nurse, or those type of medical professionals. So go ahead and take a few minutes to watch this video.
A community health worker is really the bridge between the healthcare system and the community. They're the eyes and ears of the healthcare system, looking at what the environment's like that we're sending patients back into.
Community health workers can spend more time with their patients, but more importantly, they come from the community. So they understand because they themselves have a similar shared lived experience, or they've had to overcome and build their own resiliency.
We've always lacked that ability to kind of go outside of these walls. We can't see what the patients are up against in their actual setting at home. So community health workers are able to leave the clinical setting and kind of go out into the community and bridge that gap.
Mi corazón está al 30% y traigo marcapasos. Loma Linda me mandó a las clases de diabetes y yo fui y ya la enfermera me dijo que llenara la aplicación. Yo le dije que no sabía y le hablaron a Alejandra y ella vino a ayudarme a los papeles. Sí, porque yo no puedo el inglés, ni sé escribir ni leer ni nada, entonces ella me ayudó en todo.
I explained to her part of my work, but I don't like to be like, this is what I do, boom, boom, boom. So it's more like a friendly conversation. So I told her, like, I can do home visits if you want. We can just talk. And if something that I can help you with, I'm more than happy to do it. But this is going to be like together, like hand to hand.
Sí, ahora hay un cambio mejor de mente y de cuerpo. Ahora ya puedo caminar más. De mente me siento mejor, porque antes tenía como sentía mi muerte y pues sentía como mucho depresión. Y ahora ya siento que estoy mejor. Y antes tenía que andar aquí en mi casa con bastón. Y ahora camino sin bastón y ya camino, voy a las tiendas y todo. Y hago ya más actividades que antes.
The way that she's been empowering herself, she's been growing a lot. And little by little, she's been able to advocate for herself.
Para mí es importante ella porque ella me ve como ser humano. Ella es importante para mí porque es mi compañía, me ayuda con la cita, los papeles, me ayuda con medicinas y a veces convivimos un poquito así y así. Es muy importante para mí ella.
Because the community health worker is not clinical, they are very much community focused. They can tap into a lot of those resources that we just don't have access to. We give them a plan here, and then she is able to see in the home setting what their barriers are.
Healthcare for decades has been trying to solve community issues from a healthcare perspective, but we'll never be able to really accomplish that unless we are engaging that community as partners in the process. Alejandra has been just a wonderful example of what a true community health worker does and is. It starts with the heart. They have to have a heart for service.
That's what I'm here. That is, I wanted to be with them in the same boat. No outside, with them, inside, in the same boat with them. It's the best way that you can see the missing parts of the puzzle. So this kind of work that we're doing, we're gonna be able to touch more in depth on the patient, not just as a patient, but as a human,
Now you can discuss how depression can be managed, discuss the relationship between stress and depression and its effect on the heart and on one's health, and identify community health worker activities that can help community members cope with stress and depression to improve their well-being. Don't forget to go to the Google Classroom to complete the assessment for Module 10, Mental Health and Wellness. And congratulations on completing Module 10, the final module in the Community Health Worker Cardiovascular Health and Diabetes training.